Center in Wheaton, Maryland, not far outside of Washington. Live coverage on C-SPAN.
And President Obama.
Good afternoon. My name is Fran Garfinkel.
Please, everybody have a seat.
Thank you. In November 2007, I received the awful news that I had breast cancer. As you can probably guess, I had surgery, chemotherapy, radiation therapy, and medication. As a follow-up treatment, I need an anti-estrogen medication for at least 5 years. Last July, when I went to fill the prescription, the pharmacist told me that I was in the donut hole and would have to pay the total amount for a 3-month supply. In addition to my anti-estrogen medication, I have to take 3 other prescription medications, all of which I have to pay for completely out of my own pocket while I'm in the donut hole. My husband and I cut many quarters to buy the prescriptions I needed. Then, this May, I reached the donut hole again, and the whole nightmare started from the beginning. I guess the good news is that my meds are so expensive that I will get out of the donut hole before the end of the year. But that's not exactly something to cheer about. Like so many others, my husband and I are on a fixed income. It's pretty scary. We pay for Medicare, Medicare supplement plan, prescription drug medication, dental plan, and on top of all the copays, we are now paying 100% of my drug costs because I'm back in the donut hole. I understand now how just one serious medical setback can cause one to lose their home and to use their savings and their retirement fund. That's why I am grateful for the new law that will give me and seniors like me some relief. Thanks to the new health care bill signed by President Obama, I'll be one of the millions of seniors who will receive a rebate check this year. To help me pay for my prescriptions. And in the years ahead, the donut hole will be completely closed. That means seniors like me won't have to hear the pharmacist tell them they've hit the gap, and they won't be forced to scrimp to get the medicines they need. I want to thank the President and Congress for making that happen, and it gives me great pleasure to introduce the President of the United States, President Obama.
Thank you, everybody. Thank you. Thank you so much. Everybody, please have a seat. Well, it is wonderful to see all of you. I want to thank Fran for that wonderful introduction, and I want to make a few acknowledgments before I make some opening remarks. First of all, we've got one of the best secretaries of Health and Human Services that we've ever had in Kathleen Sebelius. Please give her a big round of applause. I want to thank Governor O'Malley for joining us here today for his terrific efforts. I want to acknowledge our wonderful senior senator from the great state of Maryland. Barbara Mikulski is here. Ben Cardin couldn't be here, but he's wonderful too, so give him a round of applause. We've got U.S. Representative Chris Van Hollen here, and U.S. Representative Donna Edwards. And I wanted to just let you know they fought hard on behalf of seniors and on behalf of this health care bill, and I could not be prouder to be joined by them. I really want to thank Fran for sharing her story with us. I want to thank everybody who's joined us here at the Holiday Park Senior Center. And there are a lot of people who are listening and watching all across America, so I appreciate all of you as well. I'm looking forward to taking some of your questions. But first, what I want to do is say a few brief words about the Affordable Care Act that we passed a couple months back and what it means for America's seniors. You know, it's hard to imagine today, but just 2 generations ago, millions of our seniors went without basic health care coverage. Millions. It wasn't right. It wasn't reflective of our values and who we are. So rather than allow that reality to continue, we made a promise to America's seniors that you can live out your golden years with some basic peace of mind and health coverage that you can count on. That was the promise of Medicare. Now, the Affordable Care Act renews and strengthens that promise. This new law recognizes that Medicare isn't just something that you're entitled to when you reach 65. It's something that you've earned. It's something that you've worked a lifetime for. Having the security of knowing that Medicare will be there when you need it. It's a sacred and inviolable trust between you and your country. And those of us in elected office have a commitment to uphold that trust. And as long as I'm president, I will. And that's why this new law gives seniors and their families greater savings, better benefits, and higher quality health care. That's why it ensures accountability throughout the system so that seniors have greater control over the care that they receive. And that's why it keeps Medicare strong and solvent today and tomorrow. Now, you've just heard Fran's story. When Fran was diagnosed with breast cancer, the cost of her medication surpassed the Medicare Part D coverage limit, but it didn't reach the catastrophic coverage threshold. So she found herself in this coverage gap called the donut hole, where she was forced to pay the entire costs of the medicine she needed out of pocket. That came to thousands of dollars, forcing her and her husband to cut back everywhere else. And I think everybody here understands Fran's story is not uncommon. I've heard others like it all across this country, and I read about it when I read letters from so many of you at night. Those stories, your stories, are why we passed this law in the first place, to ensure that we don't have to keep on telling this same story. Now, this debate got pretty contentious at times last year, I think you remember. And just when you were looking for accurate information about what this reform would mean for you, there were a lot of opponents of health care reform generally that sought to deny you that information. And they ran some pretty nasty rumors in hopes that it would scare folks. I know that's hard to imagine in politics, but that's what happened. And we had seen it before. In the 1930s, when more than half of our seniors couldn't support themselves and millions saw their savings vanish, there were a number of opponents who argued that Social Security was going to be socialism. In 1965, plenty of folks warned that Medicare was going to lead to a government takeover of the health care system. Same argument that was made earlier this year and last year. We found out that those warnings had no anchor in reality, and neither do the hysterical claims about this law. So here's the truth. First and foremost, what you need to know is that the guaranteed Medicare benefits that you've earned will not change, regardless of whether you receive them through Medicare or Medicare Advantage. Your guaranteed benefits will not change. Eligibility won't change. Medicare will continue to cover your costs the way it always has. If you like your doctor, you can keep your doctor. In fact, we're taking steps to increase the number of primary care physicians so that seniors get the care that they need. And I'm committed to reforming the way in which we compensate doctors under Medicare, because right now it doesn't make any sense. I don't think some of you may be aware of the fact that we've got this patchwork system where Medicare doctors each year have to see if they're going to get reimbursed properly or not. And we've got to change that. And that's something that I'm committed to doing. And I'm going to keep fighting for doctor pay that is more cost-effective and efficient, and I urge Congress to pass a short-term fix today, and then we need to fix this thing over the long term tomorrow. So those are the facts. What you'll see through this new law are new benefits, new cost savings, and an increased focus on quality to ensure that you get the care that you need. And we're moving quickly and carefully to implement this law so that you begin to see some of these savings immediately. Case in point, beginning this week, tens of thousands of seniors who fall into the donut hole, like Fran, will receive a $250 rebate check to help you cover the costs of your prescriptions. That will happen